Hi guys, so my name is Kwan, and today I want to do just a little bit of reflections about my journey in this Gerontology 400 course. Um, Before I started on what I've learned so far, I want to share a little bit of my background, my stories, and also why I chose this course as my upper division course. So before I entered this semester, I was a volunteering student in St. Joseph Hospital for a extended period of time. I think it was for a year, and I was a co-health scholar, so I had a lot of hands-on experience on patients. The two departments that I worked on was oncology departments and medical telemetry departments. And on those departments especially, I had a lot of exposure to um, elders and working with um, older patients. So I heard a lot of stories from them personally, and also I've learned some of the healthcare systems and also how Social Security plays an important role in their life as well as in healthcare. So on the my very first reflections, when I'm reading it, I stated that I was looking for knowledge about the healthcare system, about family support, primary care, and also how social economic status plays an important role in an elder's life or in older populations. There were many key points that I've learned from this class. This actually changed my entire perspective and thinking on gerontology. One of them being the social security system and how it really affects an elder's life. So um, some of the assignments that I did actually, when I was doing research, that there were many problems to social security and the lack of funding. Um, but then, in order to resolve the problems, there were actually many other problems intertwined with it, and it's really hard to resolve. It's not just increasing the retirement age or increasing the tax revenues. There has to be a balance in the system in order to provide an adequate um, amount of money and quality to the patients and to the people. Another problems that I learned from this course, aside from social security problems, is ageism and how ageism is really affecting an elder's life and their capability of providing their work to the public and to the society. So ageism is a negative stereotype against old age and old people. It usually happens in the workplace where a lot of older workers being undervalued and because people say that they don't have much productivity and their health is not as strong as um, the younger populations or the middle-aged populations. Before taking this course, I was one of those people who had that ageism mindset and always associate aging to sickness and diseases and also weakness. So after taking this course, I became more aware of the aging process, especially a healthy aging process, can really help a person maintain physical capabilities and cognitive abilities, as well as having more experience on certain jobs. So um, older people are not necessarily correlates to weakness or sickness. Some of them can be actually stronger and more experienced at certain jobs than others. The last point I want to touch on is the importance of caregivers and family supports. Caregivers can play an important role in the life of a older patient. So, for example, simple tasks such as brushing teeth or walking up and down stairs um, can be sometimes can be a burden to the patients due to their disability or sickness. That's when a caregivers can come in and really assist them on those tasks. But it's much more than that. It's much more than just um, physical support. It's also a mental support when an older patient's having someone with them uh, in making decisions, or just there with them to talk to them and let them express their thoughts and emotions. As a healthcare student myself, I really appreciate what I've learned from this course and how it really changed my mind on uh, thinking about geriatrics and gerontology in general. Uh, I will definitely incorporate what I've learned in this course to my future practice as a nurse, and definitely become more aware when I'm working with the older population. Um, Thank you so much for letting me expressing my thoughts about this course, and thank you for listening.